views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Well, good afternoon, everyone, and welcome to COVID-19 Town Hall. I'm your moderator, Arlene Makoko from BronxNet Television. We've been covering a lot of this and following City Councilwoman Vanessa Gibson, who has been very, very busy here, and she is hosting this town hall to get some answers and to help the community and equip and educate us all on this this novel coronavirus, and hopefully provide information that can help. We are joined by Metro Plus. We have the Department of Health and Mental Hygiene. We have Safe Horizon. I know that there may be a few others that will join, but I want to take it over to the City Councilwoman, who has been covering, just out there every day, working in her community, the 16th Council District, providing food from Fresh Direct, talking with people, showing them how to, what to wear, PPE equipment, as well as most recently, we covered her opening up this recent coronavirus testing site at 1225 Gerard Avenue. So this is all the work that she's doing is so indicative of someone who, both in the city, I met her when she was working up in the state, has been on the ground in her community, very active and really in touch with what's going on. So I'm going to turn it over to the City Councilwoman. Thank you, Ms. Gibson, for what you're doing. Everyone, the Honorable Vanessa Gibson. Go for it.
Thank you so much, Arlene, and good afternoon, blessed Wednesday to each and every one of you. Thank you so much to those who are on our virtual town hall. Welcome, welcome. Thank you for joining us and participating. I hope that from today's town hall surrounding COVID-19 pandemic that you get as much information, you find it to be productive, and really a conversation on how we can continue to work together as stakeholders, as advocates, educators, healthcare professionals, and really everyone in the public sector, how we're serving residents and families, how we're helping them cope with this pandemic. It's traumatizing. Families are affected day by day. COVID-19 has not discriminated, and certainly it has touched everyone from all parts of our city, all neighborhoods, all zip codes. It doesn't matter. And we've lost thousands of New Yorkers and Bronxites to this virus, and I pray for those families that are mourning the loss of a loved one, and certainly those that remain hospitalized, the thousands that are still struggling on healing. I pray for them as well. We have to be mindful that we're going to get through this together as a community, as a village, proud Bronx residents, proud, strong, and tough New Yorkers. But there's just a lot of pain that we're enduring. But we're going to get through this together. And I wanted to take this opportunity to really come together as a community to bring all heads and minds together and hearts alike to talk about COVID-19, the impact it's having on us here in the Bronx. We know that the Bronx has some of the highest rates of hospitalizations and deaths, unfortunately, due to COVID-19. So I think it speaks volumes to a lot of the underlying health conditions that we face every day. The health conditions around obesity and heart disease and high blood pressure and asthma rates. We were affected by these disparities before COVID, during COVID, and sadly, we will still be dealing with it after COVID. So it's really important that we not only talk about these issues, but we come up with tangible solutions and policies that we can adopt and we can support that really, really complement a lot of the work that all of you are doing. So thank you to Metro Health Plus. Thank you to Stonewall CDC, to the Department of Health and Mental Hygiene. Thank you to the Samaritans Suicide Prevention Center. Thank you, Safe Horizon. And thank you all who have joined us for this virtual town hall. I want to also speak about a Zumba event that I'm having this Friday at 7 o'clock with Metro Plus and Stonewall CDC. It's at 7 p.m. And if anyone wants any information, you can call our office at 718-588-7500. And you can email us at district16bronx@council.nyc.gov. While many of us are practicing social distancing, it's also important that we stay active. I know because we're home, we tend to eat a lot more. We have to keep our body moving, our mind moving. So we want all of you, if you're free Friday at 7 p.m., to join us for a night of dancing and health and wellness. Today is also Denim Day because April is Sexual Assault Awareness Month, in which we come together and stand in solidarity with survivors of sexual assault and sexual violence. Many of us are wearing jeans. We're posting pictures of ourselves on social media, Denim Day NYC, and we're using hashtag of violence-free future needs. We're talking about supporting victims of domestic violence and sexual assault, intimate partner violence, supporting our youth, our LGBTQ community, and how we can better protect them, survivors and thrivers and their families, because we know that anyone who has been a victim of a sexual assault is traumatized, and we want them to be survivors and thrivers. Also want to recognize that April is the National Minority Health Month. This is a time to bring awareness about health disparities in many of our marginalized and vulnerable communities. And we encourage action through health education, early detection, early screening, and controlling many diseases and its complications. In the City Council, we are slowly resuming our hearings virtually, as you have seen. We had hearings last week. We had the very first ever remote City Council stated with all 51 members of the body, and we're going to resume that again on May 5th. And we've had hearings today. We have a hearing Friday. So we're slowly starting to get back to whatever normal means, but we are thankful for the ability to get together in some way. Also want to thank you, Arlene, for acknowledging that we've been working with the city with health and hospitals. We have a new COVID-19 testing site that just opened last Monday. It is the Gotham Health Morrisania site at 1225 Girard Avenue between 167th and 168th Street. It is operating from Monday through Saturday, 9 a.m. to 3 p.m. Walk-ins are accepted and appointments can be made by calling 311. I had a chance to visit last Saturday with the mayor, and it was crowded. Every day there are hundreds of people that show up. The capacity is about 250 to 300, and we're closely monitoring this site to see if we can extend the hours past 3 o'clock and accommodate more residents, because we also know in order to curb this pandemic and slow the growth in more cases, people really need to be tested. And our residents in the West Bronx simply cannot get up to the Northeast and the Northwest. The drive-through sites are not accessible for us. Many of our constituents don't drive, so we need sites in our neighborhood. So this is the first of others that we are opening. I'm proud to say that our Assemblywoman, LaToya Joyner, has been working with Governor Cuomo, and we have a new site operated by Morris Heights Health Center at 1227 E.L. Grant Highway, and that's at the corner of Jerome Avenue, and they are doing appointments only. So if you know anyone, have them call 718-716-4400, 718-716-4400 to schedule an appointment. We have been pushing for more testing sites because the Bronx is still disproportionately affected by COVID. Nate Silver shared information yesterday that the Bronx makes up 2.5% of the population that has tested positive for COVID. 19 in contrast to Staten Island's 2.4, Queens is 2.2%, Brooklyn 1.7, and Manhattan's 1.3. So the Bronx still needs support. We need sites for testing and assessments. And also I am reminded of the wraparound and holistic healthcare services that families need, like trauma-informed care, like healthcare, like mental health is very, very, very important. So as I close, because I know we have a lot of questions that we will get, and also all of our panelists, I want you to provide openings of what you do, who you serve, and how you can better serve. But please know that you have a supporter in me, because I am definitely working on your behalf as one of your council members. I'm doing my best as a member of the budget and negotiating team, also as a deputy leader. We're trying, because we know that there are painful days ahead. This budget is not going to be easy. There are a lot of decisions we have to make with a $7 billion loss of revenue and a $6.4 billion deficit in our budget. We're going to have to do a lot of work. Many are concerned about the youth impact, youth employment, and services for our young people during the summer, like summer camp and all the other programs that we know are so important. So I just want to be mindful of that is ongoing. We need all of your help. A lot of the priority will be focused on health and wellness and public safety, which is important, but we also don't want to neglect all of the other valuable programs that all of you provide. So once again, I thank you for joining us. Thank you to all of our panelists, participants. Thank you to everyone who has joined us. We're going to have a great conversation, but please know this is one of many that we will have. The conversations will continue. We need your help. We need your partnership, and we look forward to working with all of you. So I thank you so much. And if Arlene remains on, I will turn it back over to Arlene. Arlene, are you there? Okay, Michael, are you there?
Yes, I'm here. I think Arlene might be having some technical difficulties. So we will proceed until she's able to fix those.
Okay.
We can actually have each one of our panelists just briefly introduce themselves and give an overview of some of the work that you are doing during the COVID-19 pandemic. And we will start with Dr. Amanda Parsons from Metro Plus.
Thank you, Dr. Parsons.
Hello, Councilwoman Gibson. Thank you so much for having me here. So my name is Amanda Parsons. I am the Deputy Chief Medical Officer at Metro Plus Health Plan. We are New York City's health plan. We cover over 500,000 New Yorkers. And we've been doing a lot since COVID hit, both to prepare for COVID and then to navigate through it. So first and foremost, being New York City's health plan, our parent company is Health and Hospitals. So we've actually deployed over 200 of our staff to help with the front lines. That means our staff have been volunteering their time to answer the COVID hotline, where worried New Yorkers can call and ask about their COVID-related questions. We've been calling physicians across the United States to encourage them to come work at Health and Hospitals and to help out with the response there. We have been reaching out to respiratory therapists and others to get them to join the front lines. We've been buying coffee for Health and Hospitals employees and staffing their new hotels, and really providing, really rolling up our sleeves and providing, boots on the ground assistance. For our members, I mentioned to you, we have over 500,000 members. Many of those members are vulnerable patients. They might be elderly. They may have some of the comorbidities that you mentioned, Councilmember Gibson. And so we've been reaching out to them through innovative ways, like both phone calls and video visits, but also interactive. We've just launched over 50,000 interactive text messages to ask patients about their needs related to COVID, emotional support, pharmacy refills, you name it, anything that we can do to quickly reach out to members and figure out what they need and how we can help. We've identified some high need members who we are sending food boxes to. Over 10,000 members are going to be receiving food boxes and masks to help them navigate through these challenging times. We've been obviously also adapting our own processes. Our field-based teams are now doing all of their work telephonically. In fact, most of our company is now working remotely and adapting all of that. And partnering with others. I mean, there are innumerable partnerships that we've entered into. We're in part of a New York City-wide COVID coalition that helps to navigate resources for community-based organizations. We've been working with Amazon Web Services on the text technology I mentioned, and really just trying to find ways to reach out and help both individual people. Schools have reached out to us for resources, and we're here and we stand alongside all of the folks working closely on this crisis, and I'm really looking forward to our Q&A later. Thank you.
Thank you. Oops. Thank you so much. Thank you, Dr. Parsons. And now we'll hear from Dr. Jane Bedell. She's retired but never retired. former Assistant Commissioner at the Bronx Bureau of Neighborhood Health for the New York City Department of Health, and returned to active duty to help us here in the Bronx and New York City surrounding COVID. Thank you, Dr. Bedell, for joining us. You may begin.
Thank you. Thank you. Thanks for coming to my retirement party. That was short, wasn't it? Maybe for some of us, it was the last little gathering before we really had to social distance. So as the council member said, I have been volunteering my time to do communications, things like this. I used to be at the Bronx office, and so I now am presenting on behalf of the agency and helping contextualize the information. So, I'll just say very briefly that we are learning a lot about this virus. It's a new virus, new to us as human beings. And so there will be information that people have to take in and make sense of. And that's always hard, but it's really hard when you're fearful and anxious. And so the agency is committed to working with partners and getting credible messages out there. And just to emphasize, we are going to learn new things about this virus, but we know enough now to break the transmission. And how do we know that we know enough to break the transmission? Because actually, we are breaking the transmission right now. In New York City, the cases were going up and up, and the deaths were going up and up. And in the last few days, we have seen some leveling off, and maybe, fingers crossed, a little bit of a dropping off. Although, we don't want to jinx it. So New Yorkers are doing the things that we know will break the chain of transmission, that is keeping far apart from other people, at least physically, not really emotionally, but far apart physically, using a face covering when you're out in public and might have a chance encounter. And the other fundamental is washing your hands when in doubt. If you're nervous about something, wash your hands. So I think the best use of my being here is to answer questions, because there's just so much information out there that it's hard to digest it and get the answer to the questions that you might have as an individual or as somebody working in an organization. So I can go over the epidemiology and the transmission and kind of what's coming up next in the next phases of how New York and the state and the country respond and recover from this as the weeks and months progress. So I'll leave it right there for that right now. Thanks.
Okay, thank you so much, Dr. Bedell. We appreciate you coming out of retirement. Thank you so much for your work and coming back to volunteer and provide, critical input on how we continue to move forward with this. We are grateful for that. Next, I want to recognize and call on our Executive Director of the Samaritans Suicide Prevention Center. We know that that's always a priority, where too many New Yorkers are falling into depression and some of them fall into suicidal thoughts. So we wanted to have Mr. Alan Ross talk about the work of his organization and what they're doing now around COVID. So Mr. Alan Ross, Executive Director, Samaritan Suicide Prevention Center, you're up. Thanks for joining us.
Thank you. Thank you, Councilmember Gibson. We want to thank you, the department, other organizations. Samaritans, for people who aren't familiar with it, is part of the world's oldest and largest suicide prevention network. Actually, Samaritans created the world's first suicide hotline in 1952 and spread throughout the world, and has over 400 affiliated centers in 32 countries. And we're the one that operates in New York City. We work with contract agency with the New York City Department of Health and Mental Hygiene. I long to retire myself. You set a bad example. We're working very closely with the City Council, and Council member, that if it weren't for the City Council, Samaritans, hotline and public education programs would not exist in the form they do. So we thank you. I think that there's so many lessons to be learned here. When we do hotline training for people who come to work on the hotline, we use a lot of phrases that are becoming very germane today. One of them is have great respect for that which you do not know. That's a mindset that we take when we talk to someone who's in crisis, who's depressed, who's experiencing trauma. And I think it's something that comes to mind very much today, that we need to approach this with humility and sensitivity and awareness. Another phrase that we use is people who swim together don't tend to drown. So the importance of community outreach and connection that many of the people on the panel are providing, and countless other, we call them members of New York's caring community. All of us working together, agencies large and small, to strengthen the safety net. But I want to focus on the point that you made, which is a lot of struggles and challenges that people have existed before COVID and will continue during and after. And it's very important that we keep an eye to that. If you looked at some of the basic warning signs of depression or potentially suicide behavior, it's anxiety, it's trauma, isolation is one of the greatest risk factors. And here are all things that we're seeing manifest for everybody during this period. So it's so important that we not only look at the science and the clinical medical aspects of it, but we look at the behavioral, psychological, emotional, and what Samaritans refers to as the humanistic side of helping people. Because everybody needs a helping hand at some point in their lives, and certainly that's becoming much more relevant today. We're specifically concerned about all the caregivers and health providers and medical personnel and clinicians who are under extreme stress in terms of helping other people and aren't necessarily getting the help and support that they need. It's not neglect by anybody, it's just hard to cover everything when we're creating things as we go. The other aspect is, and it's just one of the things that we're doing, and Samaritans is a small community organization, so we have a smaller bandwidth, but we're trying to do our part. And we've created what we're calling the New York City Mental Health Wellness Support Line. There's a lot of hotlines and places that people call out when they need help, when they're feeling a reaction to something. The Wellness Support Line is an attempt to allow people to be proactive, to make mental health maintenance part of their ongoing daily care and treatment. And so this mental health wellness line allows you to call and actually make a reservation to receive a call from a Samaritans hotline volunteer, people who are trained in active listening, emotional support. Basically, it's this non-judgmental approach we practice, which we call befriending. So we're very much invested in that. We're, like everyone else, having to find new ways to deliver service. We've actually reached out to all the 51 council members because your staff is under a lot of stress and is trying to handle a lot of difficulties and challenges from your constituents. And we're trying to make sure that you have the resources and support. And the people providing that support are under stress themselves. We're reaching out to caregivers and health providers, and certainly to the people who call the hotline or who have lost loved ones to suicide, of which something like the COVID pandemic is further triggering their experiences and trauma. So this mental health wellness line is 212-673-3661. People can call, leave a name and phone number, and schedule to get a call at their home or at their work. So that's one thing that Samaritans is doing, including other forms of outreach, training, education, sharing resources, etc. I'll look forward to questions that people ask, and I'll leave it there.
Thank you, Mr. Ross. We appreciate it. And I've long had a relationship with you, and Fiona is great at the Samaritans. She always has a presence at City Hall, and I appreciate that you guys have a continuous service through the hotline. That's really important, because I think when people fall into depression, it's really hard to get a sense behind closed doors of what family members and their children are enduring. So as much as we can do door-to-door visits and wellness checks, that's always a great thing. So I'm grateful for that, and thank you for joining us. And now I want to recognize and introduce our Vice President of Criminal Justice Programs for Safe Horizon, another great partner that has been working with us. Safe Horizon has been actively providing services to so many affected by domestic violence, individuals and their families, wraparound services, and ongoing work. So we want to hear from our Vice President, Ms. Maureen Curtis. Thank you for joining us, Maureen. You're up.
Thank you so much for having me, and thank you so much, Councilmember Gibson, for having this town hall, because I think that sharing of information and talking about what services are out there are critical for our communities. So Safe Horizon is the largest victim services agency in the country, and we serve all victims of crime. We're very well known for our work with victims of domestic violence and victims of sexual assault, but any victim of crime can come to our programs and receive services. So whether you're a victim of a burglary, a robbery, a stranger assault, intimate partner violence, family violence, trafficking, anything, you can receive services from one of our programs. And it doesn't matter, even though we work closely with our criminal justice partners, it doesn't matter if you've chosen to report to the police, you can receive services in our programs. So how has our services changed since COVID? So we're a large agency. We have programs throughout New York City. We have a staff now of close to 1,000, and probably 3/4 of our staff are working remotely, but still providing services. I'll speak first about the programs that are still providing services in person. They're what we call essential services. Our hotline, which is the New York City Domestic Violence Hotline. There's also a crime victims hotline and a rape sexual assault hotline. They're still operating 24 hours, 7 days a week, where anybody can call in to speak with an advocate at any time during the day, any day of the week, and receive services. So that's something that in the moment they can receive services. Our child advocacy centers, which provide services for children who have been sexually abused or severely physically abused, there's one in every borough, are still providing services in person in the centers for any children or families who are referred to this program. And our street work project, which operates an outreach, a drop-in center, as well as an overnight shelter for homeless youth, is still providing services in person. And many of the young people that come into this program are LGBTQ youth who are in, who are homeless, and often because of, are victimized in the street because maybe they came out as a trans or a, lesbian or gay young person. And then our shelters. We operate about 50% of domestic violence shelters in New York City, and we are still accepting individuals and families into the shelter. And they're not at capacity yet, so if a person is in need and they're a victim of domestic violence, they can call the hotline and be assessed to come into the shelter. So how about the other programs that are operating remotely? So one of the things that I really want to get across is that even though a lot of the services, and not just by Safe Horizon, but a lot of the victim services agency in the city, as well as in the Bronx and in the city, are operating remotely right now. But what's really important to know is that help is still available. The services that were there pre-COVID are still here after COVID. They're just operating differently. So for example, we have staff who work in all of the family courts. So if anybody wants to, if they're a victim of domestic violence and they want to petition for an order of protection, all the courts now, the court buildings are closed. So what do? They can call the court, and it's likely they're going to get referred, or they can come directly to, or call directly to our family court office, and they can be meet with a advocate over the phone who can help them petition online for an order of protection, and they'll get it either same day or the following day. And in addition to helping them petition, they can do a safety assessment and safety plan around what does it mean to serve that order of protection, what does it mean to enforce that order, and what are the needs that that person may have. We have a program that works in the precincts. Every single police precinct in New York City have 2 advocates who work side by side with police officer. One who works with victims of domestic violence and one who works with all other victims of crime. They are also working remotely. But what's really important, that's really made a difference in enabling us to continue to provide services is the strong relationships that we've built with our partners in these disciplines. So daily we are calling, and the officers are calling us to refer clients to us so that we can provide additional services that the police, may not be able to provide. So, because they're trained in a way that's different than us, and we're going to be, it's our job to be more knowledgeable about the services that are out there and be able to talk more in depth about what that person may decide is the best next step for them. And I think that what's really important to know is that we, more than ever, have been thinking outside the box in terms of what safety planning may mean. A person, may not want to go into shelter because they're afraid of catching a virus living, in a communal living. And we'll talk with them about, what shelters are doing differently, in terms of social distancing, in terms of doing more remote work. That could help them to make an informed decision as to whether or not that's something that they want to do. So all of that is happening over the phone. We're tweaking how we speak to our clients, recognizing that the COVID is going to have an impact on them differently. As was mentioned, it's going to have an impact on the trauma that they're experiencing. And we're going to, talk with them in a way that the safety plan is connected to whatever their needs are right now so that they can keep themselves and their families safe. And then I think the last thing that I would say, and this is why I'm so happy that this town hall is happening, is it's really important for all of us to work together. It's so good to see all the different disciplines at this town hall meeting because everybody sees people at a different point. But sadly, somebody I may see may need services from the suicide prevention, or somebody that the suicide prevention hotline may need, may identify somebody who is a victim of a crime and may benefit from the services that we provide. So having these meetings so that we can, talk with one another, talk with the community and let them know how our services have shifted, but that help is still available, and how we're continuing, and in some cases even more so, working together to continue to provide holistic services for those in need. And I look forward to questions at the end. Thank you very much.
Thank you so much. Thank you, Maureen. I appreciate it. Thank you to Metro Plus, to the Department of Health, to Samaritans and Safe Horizon. And I agree, there are a lot of people on the call that represent different areas in the healthcare sector, the not-for-profit sector, advocacy groups, civil rights groups, domestic violence advocacy groups, women's groups. So we appreciate everyone participating, and I'm grateful for all of you for your insight, your suggestions. I think in this COVID world, once we get out of this, we are still reminded that, we will never get back to what normalcy means, but our normal will be to provide services in a creative and innovative way to make sure that our clients know that we're responding to what they need. And this is not a one-size-fits-all approach. We can't have one solution for a multitude of people because it just doesn't work that way. Everyone is coming to us with different issues, and it's multiple, it's profound. It's very challenging. And so I know that we're all doing our very best under very difficult circumstances, but I know we will get through this. We have to, because we don't have a choice. And so I'm grateful for all of you for recognizing the value, the contributions, first responders, and all of our essential workers, which I want to recognize are predominantly women and women of color that are out there on the front lines in our hospitals and serving our kids in the cafeterias from our schools. There's a lot that's happening. So when we have a 7 p.m. clap because we care, it's because we really do care. And we know that heroes and sheroes don't always wear capes. They wear hospital gowns, they wear shrubs, they have masks on and face shields, and they're our first responders. So I'm grateful for all of you. And now as we begin the question and answer period, I'm going to turn our town hall back over to Arlene. Thank you all for participating again. Arlene, you're up. Kelly. Arlene, are you there?
Yes, hi. Great.
Oh, yes, there you are.
Yes, great discussion, and I have some questions here, some really helpful advice, and it was great to hear what Safe Horizons is up to. I want to start with Metro Plus. If we can find out what are the 5 most important things people should know about COVID.
So I think Dr. Bedell, the legend, covered a great many of them, but I just, in the interest of making sure that they are crystal clear, I'll cover some of them. The first we talked about was cleaning. Make sure you're cleaning the surfaces, as well as, we talk a lot about cleaning your hands, which is really, really important. And make sure you're cleaning your hands for at least 20 seconds. And if you don't have access to soap and water, you're using an alcohol-based hand sanitizer. But we also have to think about cleaning the surfaces that we're touching. We know that these air droplets can last for up to 3 hours in the air and then fall, but they can also linger on plastics for several days, on cardboard for up to 24 hours, and on metals like copper for a couple hours. And so that means that if you're going to the grocery store and you're opening up something to pick out the milk and closing it and putting your hands back on the shopping cart, et cetera, all of those are possible modes of transmission, even if you're wearing a mask. And so it's really important to think about, what are you touching and how do you make sure you're cleaning your hands, wiping it down, carrying wipes if you possibly can. And even in your home, as people are coming in and out of your home, maybe you've taken a package that you've received and put it on their kitchen counter. Cleaning that kitchen counter and disinfecting is really important. So cleaning. The other is covering, right? Thinking about how you cover your nose and your mouth. That's really important. I see a lot of people with masks and they wear them below their nose. You need to cover your nose and your mouth. Obviously, covering your eyes is a little bit more complicated, particularly if you're wearing, the kind of mask that doesn't have a clear shield, but you really should be focusing on covering your nose and your mouth. And people are saying, well, when should I be doing that? Frankly, as much and as often as possible. Certainly when you're outside of your home. Don't wait till you get to the grocery store and enter into the grocery store. The minute you walk out of your apartment, before you even just leave your apartment, like your actual home, put it on so that when you're in the elevator with other people, you're wearing your mask and you're keeping yourself safe and you're keeping them safe. And people say, well, I don't really need to wear one at home, right? Well, not so much, right? You do need to wear one at home if you're sick. If somebody else in your home is sick, it certainly will help to prevent transmission. And if you're having visitors come in that, maybe somebody's dropping something off or doing something in your home, really, that would be a good time to be wearing a face covering in your home. So covering is really important. The physical distancing as well is just critical. We're seeing so many incidences of people, gathering together still. And it's really just, I know it's hard and it's really stressful for families, particularly we just went through the holidays and it is hard for families to be apart, but really trying to think about, if you're going to have to be with other people, try to keep at least 6 feet away. And that physical distance, and I use the word physical distancing as opposed to social distancing because that gets me to my next point. Being connected to loved ones for your own sake and your own emotional well-being. But we think a lot about, at Metro Plus, we have lots of members who live alone and they feel incredibly isolated. So reaching out to people you haven't reached out to in a while, phone visits, setting up video visits, setting up Zoom visits with friends, I think is really, really important. And being mindful of staying connected. I think the other thing I would say is we tend to forget, children aren't really as impacted as or at as high risk for COVID as older seniors or people who are sicker are. But children are still really experiencing a very challenging time. Their structures, their days have been completely unended because they're no longer in school. They're doing these virtual classes that are, they're not getting the kind of interaction that kids frankly need. And so really thinking about the children that and recognizing that even though they may not have the words to explain it, they may not have they may not even show it, but it is overwhelming for children, and finding ways to talk to them about their feelings and engage them in playful and constructive activities like reading a book together or learning to cook something together, watching a movie, drawing, painting, playing cards, or even just simply just talking to them is going to be really, really important during this time. And the last thing I would say is getting the care that you need. A lot of people feel like in times of crisis, like I have to go to the emergency room. And one thing that we want to be really mindful of is emergency rooms are really perfect if you have a life-threatening emergency. However, if your issue is not life-threatening, there are other places to go. And many people don't even feel comfortable going to the hospital. So thinking about things like your own insurance plan, like Metro Plus has it, but so do other insurance plans, I'm sure, have the ability to do telehealth, both for mental health and for clinical health. You can talk to a doctor virtually, just like we're doing now, and you'd be surprised at how many solutions can be found through that. They can prescribe you medications, they can ask you questions, just like if you were sitting in a doctor's office. And so thinking about telehealth options, like I said, can be available through your health plan. They can be available through your health system, like health systems like where I used to work at Montefiore and others are, places have at a health system level, they have telehealth solutions. And then your individual doctor, like your primary care doctor, they're all trying to do business now differently too. So they might also have telehealth visits that are available. And the good news is those are covered services now under Medicaid, certainly, and other insurances. And so if you don't feel comfortable going to a doctor or your doctor's office is closed, make sure you're thinking about what settings are available to you, and don't just default to the emergency room, because we're really trying hard to make sure that the emergency rooms that are already crazy crowded and bustling are really there for people who have life-threatening emergencies. So those would be the top 5 things that I think are important to convey to people who are worried about COVID.
Well, thank you. You covered my second question. I just wanted to add public transportation. Is there any advice you can give people that that might see maybe a crowded bus? Should they get on? Should they wait? Or even a train, perhaps? Along with what you're saying, can you offer some advice in that? And thank you for talking about families coming together, children. Just so important for a lot of families out there that may not be getting all that information. But in terms of public transportation, even some essential workers, they might find a bus that's crowded. What should they do?
I mean, I think this is really tough, because if that's like the only bus that's going to get you to work on time, and there are consequences to getting to work on time, you got to think about how you protect yourself. So having that mask is really important, right? Having a face covering, a mask, something that protects you. And ideally, even if it's crowded on a bus, if everybody wore a mask, the rates of transmission would be much, much, much lower. If people didn't stand around facing each other, but instead tried to face away from each other, so they were minimizing the amount of breathing that's happening. I think trying to think about times, maybe you can work with your employer or work with wherever you're going to just travel off hours. There are peak travel times, and there are times where it's not so busy. And if you have the flexibility to travel and you need to travel by public transportation, and that isn't a choice for you, thinking about times that you can travel that are less crowded. And it's really difficult, because obviously if we could all stay at home, and safely do that, it would be easy to encourage people to do that. But a lot of people do need to move around for a host of really important reasons. And so just staying safe, protecting yourself. And again, getting back to that list, washing your hands after you get off a bus, carry hand sanitizer with you or wipes, so you can make your own. And there's plenty of videos about how to do that. Just wiping yourself down and just keeping yourself as protected as possible. And thinking about where you sit on that bus. Maybe there's a part of the bus that's less crowded where you can face away from others. I mean, it's all about risk reduction in this day and age. And there's nothing that's 100% safe, but really being thoughtful and mindful about it all the time can help significantly reduce your risk of transmission. And last, I would say just going out only when you have to, right? And trying to make one trip. So instead of going to the grocery store multiple times in a week, if it's possible, trying to limit that to one time only, so that you're minimizing the time you're being exposed to others.
Wonderful.
I'm going to chime in just a couple of things, if that's okay, Dr. P?
Yes. Yes, go right ahead.
So just to say, from the city's point of view, that there are new policies and procedures in place in terms of disinfecting the hard surfaces that are everywhere in public transportation. So the city is taking steps to try to make public transportation safer. Still, all of the precautions apply, and everything that Dr. Parsons just said still applies. And the other is that more and more people are walking or riding bicycles. I mean, in my neighborhood here, I'm seeing way more people out on bicycles than I've ever seen before. And I'm somebody who's out on my bicycle from way before COVID. So people are, starting to take in creative ways to get around. But basically during this time period, unless your work is essential or you're doing an essential activity, you shouldn't be traveling. There will be a time in the future where we're going to slowly turn things back on. This is not that time. So I just want to be mindful about answering that question, because really, and I'm sure you would agree, that what we have to do is to remind people that they've got to put themselves on pause as much as they possibly can. And the best thing to do would be to walk or ride a bicycle, something where you're completely separated from people.
It's a great idea, definitely. And while you're there, I did want to talk about undocumented individuals. So what resources are available by the city for those seeking COVID testing, but they don't have health insurance or a primary care doctor?
Right. So let's talk about testing a little bit. What we have now is one test. It's called a PCR test. And it's one that people have probably heard described. You have to put the swab up inside your nose and get up in there to get a good sample. And then that test finds little fragments of the virus. And that will tell you whether you actually have an infection right now. Coming up, as it's being developed, it's not really ready for prime time yet, will be a second test. And that is either called serology or antibody test. And what that test measures is whether your immune system ever in the past saw this virus and built up an immune response, that is antibodies to the virus. So right now we have one test, but we will have two tests, and they're going to answer different questions. And so just as, people who were affected by HIV had to learn and become virologists and test experts, now we're all going to have to learn a lot about the testing. Right now, the PCR, or the test that can find out whether you have the infection right now today, is available, as the council member said, at several places throughout the city. They are all H+H sites, and they are in the neighborhoods that are most affected. And they're, the best way to find them is 311. Your immigration status has nothing to do with getting tested, and your ability to pay will not be a barrier to you being tested. So you can go to the H+H website or call 311 and ask about testing. And I tried it out myself to see whether the 311 information was being put out. And at least the person that I got had very accurate information, was able to guide me to a place in the Bronx. So the system seems to be working, and every person who qualifies for a test will be able to get tested. There isn't a tremendous amount of tests yet. Everybody's heard that there's a relative shortage in this country. And that is something where we're going to need help at the federal and the state level. But New York is getting pretty clever about being able to fend for ourselves. And so more and more of the testing and protective equipment, we're getting good about ensuring that we have sufficient quantities so that we can do the right things moving forward. And of course, everybody knows that we by far have the most cases, and sadly, the most deaths in the country here in the New York, and particularly when you think of us in terms of the metropolitan area. So we're going to need the resources in order to handle this going forward. So that's kind of an answer to that question and more.
Okay, no, I do appreciate it. So you recommend that people don't walk in, it's more go to the H&H website or call 311?
I think the best thing to do is to call 311 and get the information you need to do what you want to do for the testing. Because as the council member said, there's only a limited number of tests per day at each of the sites. So you call 311, get the information for that day, and then you can take action accordingly.
Okay. Well, please feel free to add more as I go down the questions here. Really appreciate that. And in terms, I also wanted to know from you in terms of what kind of help, ways people can help during the current pandemic. But I feel that that was really addressed in terms of social distancing, masks. So very helpful, making sure the surfaces are clean, that kind of thing. Very helpful. We're going to go to the Samaritans Suicide Prevention Center. I wanted to know, how can people support their neighbors, friends, and family that might feel isolated during the pandemic and that have mental health concerns?
Well, I think that's a great question, and everyone has mental health concerns, I think, even on a good day. So I think it's important that we're all aware of how we connect with each other, how we communicate. We've been doing this in New York City for 37 years, working with wonderful people, motivated people, but even the most aware, educated, experienced people in the world frequently don't recognize what form their communication takes, their way of relating to someone on an interpersonal level, and I think an important aspect of this awareness is recognizing that when you communicate with someone, it's not about you, it's about them. And it's not what makes you feel comfortable or what you feel a need to say or what you're trying to work through. And right now, all of us are trying to work through something. So again, for caregivers and service providers and parents and all the people who have individuals they're taking care of, this becomes hard because you're trying to take care of someone else, and at the same time, everyone needs a helping hand at different points in their life, and you do have to look after yourself. There's no such thing as helping others and not looking after yourself, because you're not going to be helping others for very long. And that goes from the most basic level of a friend or a family member to a doctor or a mental health professional. There are basic aspects of what we call active listening that are helpful in connecting with people. One of them is you can't be listening if you're doing all the talking. We say when we start the Samaritans hotline training, you don't solve other people's problems for them. It's hard enough to handle your own. You don't save another person's life. You help him or her get through a moment, this moment, now. Communications is process work. It's not problem-solving work. People love to give advice. People love to tell people how to cope. We use a lot of these phrases. We train tens of thousands of people in the mental health professionals and volunteers and caregivers and parents and guidance counselors. And we develop these sayings to kind of help us kind of look at these things clearly. And one of them is, you never know what anybody's thinking. You never know what anybody's feeling. When you think you do, it's most often not about them, it's about you. So we constantly need to remind ourselves to step back, to meet someone where they are. And I know our friends at Safe Horizon and certainly the work with the department and all these programs, you have to meet someone where they are, not where you want them to be. When we do public education training for health professionals, I've asked this question for 30 years. What do you determine is helping someone? What are you looking to accomplish? And again, people are well-intentioned, and it doesn't mean that they're not effective, but most people think of helping as change and improvement, getting someone to go somewhere else, to move to a place where they think is better. But you have to connect with someone where they are. You have to accept, and that doesn't mean agree, but you have to acknowledge, you have to accept where that person is. We draw on a lot of philosophical and spiritual statements. One is an old one from Sanskrit, which is acceptance brings relief from pain. When you meet someone where they are, when you sit in the back seat, when you make the focus on them. There's a very advanced educational term that we use when we do training. It's from the Latin, and when we present it to people, we say, we'll spell it and make it clear to you so you can be effective. And the word is shut up. Stop doing all the talking. Your goal is to give someone an outlet, to give them support. Listening is a powerful tool because it breaks isolation. It helps ground someone. It helps some form of pressure release or alleviation. In fact, I don't know, Jane, how far back you go, but it was Luis Marcos, the commissioner back in the middle 70s, who first came to Samaritans and contracted us to be a city agency. And he taught me that one of the great powers of listening is helping people get grounded, helping them in their, especially people who are chronic mentally ill or having ongoing psychological problems. People ride a roller coaster even on a good day, and if they can just connect, if they can get grounded, it's more a basis of physics. If you're connected, you're more grounded than if you're not. So our advice would be, don't try to do too much. Don't tell people how to solve their problems. Don't try to fix it. People are multidimensional. There's more going on for them than you can possibly know. The same way you know there's more going on for you than other people perceive. And treat them in a way that acknowledges that this is an ongoing process, that they're worthy of support, whether you understand it or not, and you meet that person where they are.
Really, really amazing. Great information, because we're seeing also this is, in the headlines that this is impacting people in very different and very personal ways. So this is really great information that can make a difference, and would love to go to families with children. How is it that we can really make a difference there in terms of, young kids that don't have an understanding of the current situation, but are now forced to stay inside? What kind of support can we offer parents in this situation?
I hate to tell you, but I think almost there's a certain form of support that's generic. It doesn't matter your education or your role, which is people are dealing with more than they feel comfortable with. They can feel overwhelmed. They can feel out of control. All these things are trigger for pre-existing conditions, whether it's depression or trauma, or if you've been a victim, or if you have substance abuse. I can only think what's going on for people right now who are struggling with substance abuse and are now stay home. So there's so many different challenges. You're not going to fix it, but at least if you give people an outlet, if you give them the opportunity, not to try to fix it or solve it, but to explore, you're having trouble. I have a coworker who's talking about her two kids. They're pretty good boys, but they're fighting more than ever and they're having trouble. And she said, so she videotaped them so they could look and listen to each other. And it became almost like a game where they were going, okay, what did you do? What did you do? How do we deal with this? And it was just, I think we all have to be creative, and we have to acknowledge that, yes, there's nothing wrong with acknowledging that you're scared. There's nothing wrong with acknowledging that, yeah, this does create anxiety. And then how do we learn to deal with that anxiety, whether it's through CBT or mindfulness or meditation or walking or riding a bike or whatever it means. But they're small steps. They're not answers. They're stages of coping and support and ongoing mental health maintenance.
And while you're on that, what about this growth in Zoom meetings like the one we're having right now? Do you just talk a little bit about that? Are there things that people can be doing to connect that can help alleviate this isolation and problems that they're having?
Well, again, I think that's a really good point, that connectivity, connecting with people helps ground you. I'm sure both of our medical people have a better understanding of it than I do, but there is a pressure release. There is a lowering in the blood pressure. There is a change. There was a research by a guy named Brian Mashara of Montreal, on people who call a hotline. Why is a hotline effective? If it's done properly and you put the focus on that person and it's a structured conversation, it actually reduces some of the levels of the warning signs and risk factors, and even reduces suicide ideation when people get a chance to get their feelings out. The Greeks were onto this 2,000 years ago with the concept of catharsis. The Africans in the ring shout dances of the Dahomean tribes, community got together, they yelled, they screamed, they cried, and it was really mentally very healthy. Maybe we could do Zoom ring shout dances. That could probably work out. But I think all connectivity is good, but at the same time, everything in balance, too much of anything can, and again, we know with self-destructive behavior, you can try to validate the person, but if you stay with it too long, you're actually supporting the self-destructive behavior. So you got to find, as in all things, some kind of balance.
Really great information. And we're going to move on and just build this conversation. We're going to go to Safe Horizons. And what we'd like to know from you, there was an article from the Guardian newspaper on March 28th of this year stating that there was a global rise in domestic violence cases as a result of people having to self-isolate at home. So are we seeing an increase in calls to Safe Horizons for people reporting domestic violence, for example, LGBTQ individuals stuck in homophobic households or spouses in abusive relationships? And anyone can answer this, but I'd love to hear from Safe Horizons.
So we have not seen an increase in hotline calls. We initially had seen a decrease. So now that we're seeing an increase, it's actually more of an increase that's leveling out the decrease that we had seen. We work closely with the police. They're also seeing a decrease in 911 calls. And our shelters are not at capacity. We're still accepting individuals and families into our shelter, as are other shelters in New York City. And the same for our street work project, which works with homeless runaway youth. I think that what is happening is that, just like pre-COVID survivors of domestic violence, safety plan around what they have prioritized as a risk that is maybe higher than physical risk, it's happening now. So for example, pre-COVID, we may work with a survivor of domestic violence who is in a relationship where there's physical violence, maybe even severe physical violence, and yet in speaking with an advocate, they'll tell the advocate, well, my child who has autism is finally in a good school after 3 years of trying to find a school, and my child is thriving, and I don't want to go into shelter. I don't want to leave and relocate and go into another community because that means giving up my child's school. So that survivor, which survivors do day in and day out, is managing the risk to their child of pulling them out of a school that's good versus the risk of the physical violence. And they've been managing that risk all along and keeping themselves safe. So they may make a decision not to go into shelter. Similarly, we see it happening after COVID. We have some survivors, even though the shelters have taken, some precautions for communal living, as I mentioned, such as social distancing, providing some of the services remotely, cleaning, providing masks for the workers and the residents. A survivor may make a decision and may not call the hotline, for example, because they've decided not to go into shelter. Because a lot of the calls for victims of domestic violence, when they call the hotline, they're calling seeking shelter because they have decided that the risk of going into a shelter to them in this moment is higher than the risk of the physical violence. So they're going to manage that risk, and they're going to safety plan around how they're going to take care of themselves. The other thing that we know happens is that if you are now isolated and you're staying at home with the person who is abusive towards you, you may not be able to call the hotline to speak with an advocate. We have a safe chat at Safe Horizon that was created less than a year ago to help to better engage with young men of color, because we know that they were often victims of crime in New York City, and they were the fewest number of clients that we were seeing, lowest percentage of clients we were seeing in our agency. And we wanted to, ensure that we were providing as much outlets for them to connect with us. But what we've done recently after COVID was to expand. It's a chat, safe chat it's called. And this enables, through our website, a person to call in and chat about their situation as opposed to calling. That safe chat has been expanded to open it up for victims of domestic violence, for survivors who may not feel safe calling the hotline, but will feel safe chatting to the advocates. And the advocates, whether the person is calling our hotline, whether they're connecting through our other programs, are thinking more outside the box in terms of safety planning, because we know that the person, we've heard of survivors who may not want to go to the hospital because they're concerned about, being exposed to a virus there. They may, maybe an option might have been for them to stay with family or friends, and now they can't, or they don't want to stay with family or friends, even if that is an option. And all of this is, something that's recognized by the advocates, and not just at Safe Horizon, but in other provider agencies throughout the city, who are helping that survivor to see what has been working in the past and what can continue to work. And if they decide they want to avail themselves of the services, what we commonly speak of as traditional safety planning services, such as calling the police, going into shelter, getting an order of protection, we can help them access those services, or continue to provide remote services for them that will address physical violence as well as the trauma they may be experiencing. I think that one of the last things I would mention that we've also been doing remotely is, we know that some survivors, domestic violence is not just physical violence, there's all different types of violence. And one of the violences is emotional or psychological. And sometimes the person may not be in that violent relationship anymore, but the trauma now of the COVID, the trauma of losing a job, the trauma of having a loved one die because of COVID is triggering the trauma of the abusive behavior that they are no longer involved in, but they're now, struggling emotionally. And we're providing therapeutic services over the phone. So, some of this, there's been a bit of a silver lining where working remotely has opened up the door for services that will enable some of our clients to receive these services who may not have been able to come to our offices, or choose not to come to our offices, but now can receive them remotely. We're actually going to be providing, we also run 4 supervised visitation programs, one of them here in the Bronx, and we're one of the few free programs that provide supervised visitation for families. And this is often when there's violence in the home, and the non-custodial parent often is the dad, who is not able to see their child unless there's supervised visits. We provide them in the court, and since the court has closed, we've had to suspend our visits, and we're actually looking at, and likely to start next week, doing remote visits, because this will be really beneficial for the families, for the children, because even though there's been violence in the home, and the custodial, often his mom, has been abused by dad, it doesn't stop the child from wanting to see their dad. So we're hoping that we're going to be able to start this and even have it live past COVID for those families who may not have been able to come into our offices to receive this service.
really, really great information. And I wonder if you can answer this. Do you feel that violence in the home has diminished because of COVID? Is there, because you're saying you suspended visits, is there sort of an understanding that this is not the time to be violent? And I just, don't want to make light of it, but I wanted to hear from you what you feel, what you see is happening.
I think there's violence in the home. I don't think it's suspended. And when I reference suspending visits, these are supervised visits that we were providing in the court, and the court buildings are closed now. So until we can do remote visits, we're not able to provide this supervised visit between the child and their custodial parent. Domestic violence, I don't think has diminished. I think that, if you think about living in a home and now being told that you have to stay in the home with your partner, with family members, and just naturally that's going to raise, tension and stress, and, even in the best relationships, that's, something that can happen. And if you add violence to that, or even the threat of violence, yes, it's going to mean that, it's more likely that there is violence happening or likely to happen. And that's why thinking outside the box in terms of safety planning is really important. And I think somebody mentioned this earlier in terms of, the connecting to the community and reaching out, even more now. It's important all the time, but even more now. If you know somebody, a family member or a friend, and you suspect that they're a victim of domestic violence, whether it be intimate partner violence or family violence, reach out to them, touch base with them. It doesn't have to be about, this is a chance, more people are connecting by phone, by Zoom. And it could be just a way to connect, but, how you doing? Is everything okay? You don't have to ask specifically about the violence, but just that touching base with that person really can go a long way. And then it'll be up to that person as to whether or not they want to, talk with you about what's happening, or if they feel safe to talk with you. But, because you've now connected with them, that can really make a big difference in their life. Because, violence is not stopping, and it's likely that it's increasing. We're just not hearing about it.
You're not hearing about it. And with that, you talked about the program. What are some of the programs available through Safe Horizons that we can share with our community for vulnerable populations? And what advice can you offer someone that might be hesitant or afraid to reach out for support?
Well, I think that the programs that all of our programs are operating, many of them are remote, but we're still providing services. So if a person is interested in petitioning for an order of protection, we can help them do that remotely. And we're skilled and have the relationships in the court where we can, you'll get an order of protection, same day in most cases, and if not, next day. And at the same time, we'll safety plan with you. The hotline, the New York City hotline that's run by Safe Horizon, it's 24 hours, 7 days a week. Where in the moment, an advocate can answer the phone. If you're interested in more therapeutic services, we have staff in our community program that are social workers, as well as staff in our counseling center that are providing therapeutic services over the phone with their clients. So I think that no matter what your need is, if you're a victim of any type of violence or any type of crime, and you just want to talk with somebody and explore options, you can go to our website, you can call our hotline, and our hotline will connect you, will do an assessment, provide services, and let's say you need advocacy with the police, or let's say you don't have food in your refrigerator, and maybe you need a Target card. Right now we have electronic Target cards where we can provide that for some of our families that may be in need. Or, you're a NYCHA resident and you're interested in applying for an emergency housing transfer. We run the emergency housing transfer program, and we can do an assessment with you. And if you say, yes, I'd like to transfer, we can help you do that transfer. if you get an apartment offer, we can help you pay the rental fees, and we can help you, I'm sorry, not pay it, but help you find the money. And, you know, we also have a fund ourselves. If we can't find it through the city or other resources, we might be able to help you with that moving expenses so that you're able to safely move to that new home. So really, it's any need that person has, we can help. And if you don't feel safe or okay to call us, this is where friends and family and others can really be helpful to know, even if you don't remember anything else, know the hotline number and let your friend or family member know, you know that, you know, Safe Horizon runs the hotline and they have advocates that can talk with you. You know, they're not going to force you to do anything. I mean, it was so great to hear, you know, what Alan said, you know, because I think that we're client-centered. We do not tell anybody what to do. You know, even if somebody's in a very violent situation, we are not going to tell them to go into shelter. We're not going to tell them to call the police. And I'm going to be honest with you, sometimes that could be hard to do if I am really concerned for that person's safety. But I know if I tell a person what to do as an advocate, they may do it because I've told them to do it, and it's not the best safety decision for them. My job is to explore all of the options with them, share my expertise in these options, in these systems, give them realistic, you know, answers about what to expect, and then and help them navigate these systems as needed so that they can make an informed, educated decision as to what is best for them concerning their safety and their children's safety in the moment, and, you know, and to know that I'm there as the advocate on an ongoing basis.
On an ongoing basis. And can you give us a sense of, in the last few weeks, last month, what sort of questions have come up? Like what is the issues that are most, that are top within your organization, like that you're helping people on?
Well, we've been doing a lot of work around helping people petition for an orders of protection. And not just for intimate partner violence, but sadly for family violence, for elder abuse victims. And because of our expertise and skills in this area, we've been successful in some cases with getting an exclusionary order of protection. You know, after COVID, I mean, it can be hard to get an exclusionary order of protection, but now with COVID, judges are less likely to want to put one of the parties out of the home. But yet if there's severe violence, we're skilled in how to communicate that to the court so that if the client, if the survivor would like the exclusionary order, they may be able to get it. We're also skilled in, you know, once again with the order of protection, maybe COVID has been used as a threat to the person. We had one client who told us that her husband spit on her and he was infected. And, you know, the advocate, she wanted an order of protection. She didn't want her husband to be put out of the home, but she asked that the judge put in the order that he was not to spit on her, because spitting on somebody is not a crime. So if she had called the police would only been able to file a report but not make an arrest. But now, if the order of protection says that he's not to do certain things, it takes non-criminal behavior and makes it criminal. So all of this are different ways that we can, you know, help survivors. We're going to talk with them about, you know, what it means to go into a domestic violence shelter if they choose to go, if they're thinking about doing it, so that at the end of that they can make an informed, educated decision as to what, you know, what it is that they want to do.
Well, thank you so much. Really great information. And we've got some questions coming in, so we're not finished yet with you. Thank you so much for this. And so Dr. Bedell would love to know, is there a connection between eating raw food and catching COVID?
Yeah, good question about food and food handling. So you'll see on the website, the Department of Health website, that there is nothing that addresses food. That's because food is not implicated in terms of transmission. Respiratory virus, droplets, back into the next person's respiratory system. So handling food with the usual precautions is safe. The acid that's in our digestive system kills the virus if there were virus there, and heat kills the virus. But if people are concerned, go back to the fundamentals. You unpack your groceries, as Dr. Parsons said, and you're concerned, wash your hands. Your groceries are in your refrigerator, and now you're going to prepare your food. Wash your hands. You're about to eat your food, and you're worried that you might have something on your hands. Wash your hands. So just go back to the fundamentals with any question that you have, and that's how you're going to be safe. But there is no known transmission via food. That's why restaurants are open everywhere. That's why you don't see guidance in my three favorite websites: City Department of Health, State Department of Health, and the CDC, and maybe WHO if you want to get a little international flavor. So food is safe, but when in doubt, wash your hands.
Okay. Okay, great information. And we have someone else that wanted to get the Samaritan service hotline again, if you can provide that. For the Samaritans.
The number that we're suggesting people call now is 212-673-3661. Tied to COVID, we're instead of receiving calls, we're making them in order just to handle both the technology and the demand. So it's 212-673-3661. That allows you to make an appointment to get a call. If you are in crisis or need an immediate response, we would suggest you call New York City Well, which is much more technologically connected and has much more immediate access to resources. So we're kind of ceding that landscape and territory to them, and we're sticking to kind of the emotional support of response piece.
Great, and if I can just add to that, Alan Ross, that is great, and I think the city 888 NYC Well number works hand in hand with the work that you all do. And another thing that people can do is text the word well in caps to, make sure I get this right, 65173. That's texting well to 65173. And then you'll get on your cell phone periodic messages and guidance and resources about emotional support and resources of all sorts. And you can get those numbers off the Department of Health or the mayor's website as well. So there's a number of places where people can go for emotional support and just to talk with someone.
Yeah, can even take that one step further. As Jane's saying, the department has a tremendous spectrum of resources and ways to get help. We also at Samaritans, at SamaritansNYC.org, have something that we've done in collaboration with the department and OMH, is what's called the New York City Resource Guide, which gives you a cross-section of texts, chat. One of the things we've learned in research tied to depression and suicide prevention is people are going to access help the way they're comfortable. So the more ways people can access help, the more options they have, the more likely, it's pretty much common sense, the more likely they are to seek something. So between the department and Samaritans, I know Safe Horizons, many organizations have these broad spectrum access to resources. We would encourage kind of like educated consumer, look at what's out there. If you want to refer, as Maureen suggested, if you want to refer a family member or a friend, don't just throw something at someone. Make sure you're connecting with them. And part of safety planning on the mental health side is finding what people are comfortable with, what they're inclined to do. And if you're going to try to help them find resources, again, make it focused on their comfort, their needs, their predisposition, not what you think would help. Most people don't take referrals and just go run with them. They need to be invested in them.
Mm-hmm. Really great information. Thank you for the 888 NYC Well, and that's 65173. That's a text to put in that you added, Dr. Bedell. Okay, we're gonna go to Safe Horizons. Does Safe Horizons have one also?
A hotline?
Yes.
Yes. The hotline, it's the New York City hotline that's run by Safe Horizon. It's 1-800-621-HOPE 4673.
Thank you, 4673. And then another question has come in. I think there are about 80 people on this town hall meeting, so it's exciting to hear that people are listening to you and getting information and have some questions. So which organizations are providing PPE in District 16 and in the Bronx?
Can I just ask what people mean by PPE? So for regular people who are out and about, the PPE is to wear a face covering. It can be a scarf, it can be a bandana, it can be any paper or cloth covering. So the PPE is really a term, I would say, that we use more for people who are working in medical settings. I know that we all use the term now, but the real need and guidance is about a face covering. If people want to, question. That's fine, but that doesn't obviate, that doesn't take away the need that you need to wash your hands, when you come back into the house, or if you're worried that you touch something. So just to be clear about what the guidance is, and there's a very good handout, I'll put it into the chat, on face coverings and kind of the guidance. Great.
Really great. Go ahead.
I would just add that we at Safe Horizon, for our in-person services that we're still providing, such as the shelters, the CACs, we do have masks and that we provide for our staff as well as for our clients in the shelters.
Great. Thank you both. And we're going to go, this is a question about hospital workers. For hospital workers staying at hotels, what level of cleaning is being done in their rooms and common areas? I guess this would be for Dr. Bedell.
I don't have the details on that. That's something I could get back to people on. But if you are in a hospital room, and you're the only one in your hospital room, then there isn't a problem with the virus being introduced. So the way the hospital rooms are working, people stay in their room and things are brought to them outside of the room, and then you take it into your room. So it isn't like you have lots of people in your room. The room is meant to keep you isolated from others. So, and again, if people are interested, I can find out more about the disinfection routines that are there, but it's not so necessary because of the isolation that the hotel room provides. So I hope that answers the question.
Okay, thank you. And in terms of resources being shared by the panelists in multiple languages, do you have material either online that you're sharing in different languages?
So
yeah, go ahead.
So this is Maureen from Safe Horizon. I would have to check to see on our website whether or not we have any of our handouts in multiple languages. I know that when we're in our offices, we do have handouts. We've created a few handouts recently that to date, one for NYCHA residents that's been distributed to the different management offices as well as on their portal that speaks to how Safe Horizon can help victims of domestic violence, particularly around transfers, and then one about family court. But to date, it has not been translated into any other language other than English. I will say that we do have a lot of staff that speak different languages. Many of them speak Spanish. Just in our precinct program, they speak up to 20 different languages. And when we don't have an advocate that can speak the person's language, we use Language Line.
Okay. Okay. I want to get back to the information on the antibody testing. I think this is going to be a big area in the months, the weeks and months ahead, as the city, as Dr. Bedell shared, is increasing the amount of kits available for testing. The mayor in his press conference mentioned that kits are coming from area diagnostics in Carmel, Indiana, and that's adding to the number, as well as a donation they made of $50,000. So the question is, this antibody testing, is that a part of these kits? Can you talk about a little bit more about that information on antibody testing?
Yeah, so again, just to separate out PCR testing, that's what we have now. That's the swab. And that will answer the question, is this person infected with the virus right now? Antibody testing, we are just starting to come into antibody testing. There are a lot of different antibody tests out there. They are not all equal. And so figuring out what's going to be the best one for New York City to use is part of what we're involved in right now. There is not antibody testing that is available throughout the city yet, just the PCR testing to find out whether you have the virus right now. And I think that's what these different things are that, if I'm not mistaken, that are coming into the city right now, because we don't have enough of the PCR tests. Do I have the infection right now? And you can imagine in the future that this is going to be very helpful, because we're going to want to know, for example, healthcare workers, home care workers, people who work in close proximity with other people. Could they infect somebody else, or could that person infect them? And we're going to want to have a lot of those tests available. And people, we can imagine that there might be, in some professions, in some work situations, people being tested at various points along the way. The antibody test, once you have antibodies, you don't need to test again, because that just shows that you ever once had the infection, and that won't change over time. So the PCR tests for the virus, that's the test we have available right now. That's the test the council member was discussing, is available at eight different H+H sites across the city. The antibody test coming in the future.
Excellent.
Help clarify that, and we're going to learn and relearn this again, because it's not so easy to grasp, except for people who know about these tests. People in the HIV community know about these tests because they've been dealing with similar tests that test for, do you have the virus right now? That's called viral load, or the HIV test, which is the antibody test. So there are people in our community and in the work that we do already quite familiar with these tests, and we need to, as Dr. Burke said in one of the White House briefings, we need to utilize those people, because they have a lot of expertise in what these tests are and what they are not.
Okay. Great information. And another question here is there testing available for folks at home?
There is no at-home test that is approved for usage, so we're not recommending that at this time. And also, I don't know, Dr. Parsons, whether you want to chime in on the testing and kind of how that's going to go. But at-home testing would be great. There aren't so many tests. Just think about it yourself. How many tests are people able to do at home? Finger sticks for glucose, home pregnancy test. There aren't too many at-home tests. So I hope that technology can be created, because that would be helpful. And also, there hasn't been so much of that technology in the past. So we'll have to see what we're able to develop. Anyhow, just pass it on to you for.
Yeah, maybe I could add here. I think the challenge is whether you're talking about testing at home, meaning you do the test and you would get the results in your home, like you do with a pregnancy test, right? Like you pee on a pregnancy test and you get your answer right there. There are other test kits that you may, for instance, bring home for your doctor's office, where you're collecting, for instance, like stool samples, where they get packaged up, and then you have to send them back to the doctor's office or the lab for there to be a read of the test. So I think I want to clarify that testing at home can mean two different things. It can either mean test and result or just sample collection. So sample collection in the home is probably already available, because if a healthcare professional could come to your home with a swab, and as Dr. Bedell mentioned, either do the PCR test by sticking the swab into your nose or your throat, and they can then take that sample and send it off to a lab, and you wait a couple days and you get a response back. That would be a version of like in-home PCR testing. Or for the serology tests that are starting to come out, being able to somebody can come to your home to collect the blood sample. So that is a version of in-home testing. And I think there are a lot of conversations about what would be the workforce necessary to mount something like that, and who would we need to test at home versus who could actually make it safely to a testing site, or even to primary care doctors' offices and other places, like pharmacies and stuff, where these kinds of tests will likely become available. The test at home and get the result at home, I'm not yet aware of such a test that exists, but frankly, things are moving a mile a minute in this space. And so I think that it will not be long before those are created. The question will be at what cost and how reliable are they? And also, what do you do with the information? I think one of the big questions about the antibody test is, what does it mean to have antibodies to the coronavirus? Does it mean that if you're ever exposed to coronavirus, you'll never get it again? And we don't think we're not sure yet how protective are the antibodies. And so I think in addition to thinking about the testing, we have to talk a little bit about what do the test results mean and how do they change or not change what we do. So more to come on testing, but I hope that addresses in part the answer to your question.
Oh, thank you. No, that was really, that was good. And I want to switch over before we continue again with testing to small businesses. We know that they are the backbone of a lot of economies, of New York City's economy. So which financial institutions in our communities are providing loans for those without existing bank relationships who are in danger of closing? And again, so many small businesses are being impacted, and I know there's been a lot of talk about what's available. If you can address that. There's someone who can talk about that.
All right, don't have expertise in the Payroll Protection Act. I know that a lot of it is being done through the banks, and so I'm not aware of what the options are outside of a bank. I think it's a really good question and one that I will look into. I don't know the answer to that.
Okay. There are, I know that there may be also community banks that are involved more on that level for very small businesses. But great. No, this is, thank you for that. I want to address this to Dr. Bedell, and it may be too early, but is it too early to talk about maybe a vaccination down the road for this, for COVID?
Yeah, good question, because that will be the game changer. There's probably, in our lifetimes at least, not been as significant a rush to try to develop a vaccine as there is happening right now. So that's good, because in lots of labs all over the world, people are working on this. And this is the area of expertise that Dr. Fauci really has. He's a medicines and vaccines kind of guy. Just to say that there are lots of viral illnesses in the world, and there are very few vaccines. So HIV, for example, and I started my years in medical school just when HIV was starting, before it was even HIV, when it was GRID, gay-related immunodeficiency. And to this day, we don't have an effective vaccine for HIV. So creating a vaccine is not easy. That being said, and people have probably seen the pictures of the coronavirus, it has a very interesting and intricate structure with little spikes coming out of it. And the structure of this virus lends itself to developing a vaccine. But in order to have a vaccine, it has to first off be safe, and things can cause harm that look like they're promising. So it has to be safe. So you have to run clinical trials to make sure it's safe, and obviously it has to be effective. So, you know, the current estimates are many, many months, 10 months, 12 months, 18 months in that ballpark. But until there is a vaccine, and until the vaccine is delivered to people, and there's going to be a lot of discussion about payment and vaccine and who's footing the bill for this and how that's going to happen. We leave that to the elected officials, but it's going to have a huge impact on how we roll out the vaccine. Until then, it's going to be, you know, we're not going to be able to go back to anything that resembles our pre-COVID life in terms of huge gatherings and those kinds of activities. So it's right to start thinking about the vaccine, not only because people are working on it very, very hard right now, but also because there's a lot of questions involved in how we're going to get it out there and who's going to be eligible and how the payment is going to work in terms of the costs of the vaccine. And those are all things that I imagine in a democracy, people are allowed to weigh in either through their elected officials or, you know, through the mechanisms that we get to the decision makers. So it's a good question to ask. 12 to 18 months is what's being said. And there's a lot of questions associated with the vaccine development and implementation that people might be interested in and want to have a say in. Good question.
Okay. Great. I'd also would kind of have a question also on just a lot of the pre-existing conditions, health conditions in the Bronx that have been talked about as really, you know, causing, you know, raising the mortality rate on this whole thing. My question is there anything being done in the Bronx that might be different in terms of outreach, in terms of treatment, in as we are in this crisis now?
I'm happy to take that question, at least from the Metro Plus perspective. I think, as I mentioned, we have done an assessment of people that we think are at risk of having what I call poor COVID outcomes, meaning that if they were to get COVID, they would have a more difficult time recovering from it. And that's everybody who has underlying heart disease, learning that people who are obese also don't fare as well with COVID, as well as people who are immunosuppressed for a variety of reasons, whether it be HIV or they have cancer or they're on dialysis. And so we've identified those patients in the Bronx as well as in Staten Island, and let's do very purposeful outreach to them. And that purposeful is
do me a favor, please. Put these things away.
Angela,
Put this stuff away from me. And hang my thing.
oh, there you go. Sorry. So I think doing very purposeful outreach to people who are at higher risk, I think, is always important. We want to make sure that everybody's educated about what their options are and what they can do, but we really, really need to make sure that the vulnerable populations, which are largely represented in places like the Bronx, have additional touches. So not only have we been doing prioritized like text message reach out to get information and connect them to like live people who can help, but also we've been calling members with our care management team and just checking in on them and saying, are you okay? And are you okay is everything from, do you have enough medications for the next couple months? Do you have enough food for the next couple of days? And we've been, if they say no, we've been partnered with really terrific organizations like AIR NYC, God's Love We Deliver, and others, who are these really incredible community-based organizations that are working through thick and thin, delivering meals and services to people who need them the most, and taking their own precautions, but still continuing to serve people who are COVID positive. So there's been a lot of proactive outreach, and we'll continue to do that, until this is no longer an issue. And as Dr. Riddell said, that's going to be for quite some time.
Okay.
And just to add on to that, if I can, the first thing is that you've got to collect the data so that you understand what the problem is. Yeah, I see Amanda shaking her head because that's used to be a big part of what your team did at the Department of Health. And so there is the data. You can see it geographically, a map, a zip code map, and then there's the charts and graphs and all of that kind of thing. Then other people are pulling on that data and creating their own maps. So it's important, if people are interested, to see what the data actually says and to demand of us in government that we provide data in ways that is helpful to solving the problem. So the data is important, and it is there. Some of it is not complete data because we draw from different hospitals and different systems, and they don't always give it to us completely. So that might be an area we want to double down in the future on. And then there are the ways that people are using the data now to show that there are differences by quote unquote race. And I always use that word with quotes because race is not a biological or scientific construct. It's a social construct. There is nothing about having pigmented skin that makes you more or less susceptible to this virus. But because of racism, we do see different illnesses piled up in different populations. And that was a reality, as the council member said previously. And I think of it as a pandemic, which is a biological phenomenon, on top of multiple long-standing social epidemics of crowded and crappy housing, of wealth in some areas of the city and with some populations, and a lack of resources in others, et cetera, such that when the virus comes around as a biological phenomenon, it gets heaped up in certain areas, and people who have big apartments can spread themselves out, or they can go to their homes outside of the city or whatever, and they can break the chain of transmission more easily. So the data is there. The history is also there. That's really what this data is showing. And the way that we're going to respond is by using the data smartly, and do that in this immediate time period. But the way we're going to become resilient, which is what you do when this is all dropped down and you're preparing so that it doesn't happen like this again in the future, is to change the systems and the policies and the programs that we have so that we don't have these tremendous disparities that are getting sort of a floodlight on them right now. And the people who live in these communities, this is not news to them, and the epidemiologists and people in public health who study this, this is not new, but apparently it's new information to other people. So good opportunity to figure out what are we going to do going forward to make it not true the next time, and there will be a next time, that a pandemic comes whipping around the globe. So those are also big questions. Starts with data and understanding the problem, and then people have to use that data to prepare for the future and make us a stronger, more equitable city for the future.
Okay. And then as someone in media, is there a role that media can play in this?
Well, one thing that is happening, thanks for saying that, because it's reminding me to say that the mayor's office and city government is working and is going to be doing focused communications to the areas of the city that are hardest hit right now. And they're putting millions of dollars into developing ad campaigns and social media messaging and all kinds of different strategies to try to get the message, the same basic public health messages, but out to communities and to people in the ways that people can hear and understand them and act on them. So the media can help with that by amplifying those messages. And then the media has been very helpful in both holding our feet to the fire in terms of having an equitable response, and also the media themselves being a source of credible information, because there's a lot of incredible information out there either that's not valid. So separating that out is part of the media's job, and, you know, very much a partner in public health as this rolls forward.
Okay. Dr. Bedell, you know, all of you, Alan Ross, amazing conversation. I'm going to turn it back over to our host, to City Councilwoman Vanessa Gibson, who brought all of you together for this amazing conversation to help to really provide that information that's going to equip people and empower people during this time. And I just want to acknowledge you, Councilwoman Gibson, for doing that. And just wondered if you might have a question to add to it, to the conversation.
No, this has been extremely productive. A lot of information that was shared. I was looking at the chat to see some of the questions that many were asking. And really all of the other participants on the call, while not a panelist, but have something to offer and bring to the table. So I appreciate that and really thank all of you. Thank you to, you know, all of our sponsors. Thank you, Dr. Amanda Parsons at Metro Plus. Thank you, Dr. Jane Bedell at the New York City Department of Health and Mental Hygiene, retired, serving as a volunteer. Thank you to Mr. Alan Ross at Samaritans Suicide Prevention Center. And thank you to Maureen Curtis at Safe Horizon for all of your work, for your commitment, your partnership, for thinking outside of the box, recognizing that our work is more critical and more important, more now than ever. And there are so many families and children out there in need. Many are living behind closed doors and violent situations, and they really don't know where to go. So calling 311 is great. We know that there's a potential waiting time on 311, so we're trying to deal with the volume of that. But really the teleconferences, the health and wellness checks, all of that is really, really helpful. I think someone mentioned it on the call earlier today. It's been troubling that some of my elders and seniors that are older and homebound don't really understand what COVID is about and don't understand why their relatives and their grandchildren can't visit them, right? They don't understand the concept of what's happening, and it's easy for them to fall into a depression. So I think it's important that we are mindful of working with all stakeholders from all sectors, that we have to address many of those people that are living home and really don't understand what is happening and why it's happening for this reason. As I mentioned, everyone is affected by COVID from all walks of life, from all corners of our borough and our city. And I appreciate everyone from the governor and the mayor. All of our commissioners have been absolutely amazing. It's information overload, honestly. It's a lot of information, a lot that's being shared, but we have to do our best to encourage people to make sure that they understand that we are there for them, for themselves and their families, that you don't have to live in a silo, you don't have to live in the shadows of darkness. You can understand that we're here to help you, we're here to serve you, and there's nothing greater than partnership. And so I know all of you understand you have a partner in me. Whatever we can do to help push this agenda along, I look forward to our continued work. Definitely want to thank Stonewall CDC. They have been instrumental in running all of these Zoom town halls because I am not tech savvy. So I've learned a lot from Stonewall. So I thank you for your support. And my director of engagement, Michael Ivory, on the call, who has been absolutely amazing coordinating all of this. We have more to come. As I mentioned, we have our virtual Zumba party this Friday. We're sending out emails. We have a lot of information coming up. Definitely want to share and remind everyone that we have to be counted in the U.S. Census. Please make sure you answer 10 simple questions, less than 10 minutes, thousands of dollars that each individual provides and will be provided in the census, billions of dollars in federal money that we need for our highways, our roads, our hospitals, our public schools. We need to make sure we raise our numbers from 10 years ago. It also means sufficient representation in the House of Representatives. Those are our members of Congress, so we have to make sure we're counted. And if we don't participate, we stand to lose one congressional district, which is very alarming. So please encourage everyone, U.S. Census. It's www.my2020census.gov, I believe. We'll put it in the chat and make sure everyone has the census website so you can be counted. Again, thank you, everyone. Thank you for your participation. Arlene, thank you for serving as our mistress. Really appreciate you. I'll turn it back over to you. Thank you, everyone, for participating. We look forward to our great work ahead. Thank you, guys. Be safe, and God bless you all. Thank you. Arlene?
Thank you.
Bye-bye.
Yes, thank you. Thank each of you. I think this is going to make such a difference. I'm very moved by the transparency by all the agencies and organizations that have been talking. This is really making a difference. And I just loved hearing this family. Somehow someone didn't unmute, was unmuted. And you just heard a mother and a child talking, and so you're reaching into homes. I just want to acknowledge you all for all that you're doing, and just hoping for the best, and thanking God for Vanessa Gibson, for City Councilwoman Gibson, for what she's providing to her community of residents.
Thank you.
Thanks,
Thank
everyone.
you so much.
Bye-bye.
Okay.
Thank you so much, everyone. Take care. Be safe.